Hello everyone, it's Kathy Foley here. I'm Australia's Chief Scientist and it's great to be here. I'd like to begin by, of course, acknowledging the traditional owners of the lands we're all coming from across Australia today. And I want to recognise their continued connection to country, community and culture. I'm joining you today from the land of the Ngunnawal people, who are the traditional custodians and rights holders of the Cabra region. And I'd like to pay my respects to the elders in the past and present and acknowledge all First Nations people present today. We have much to learn about your knowledge of the land, sea and skies. And so it's really quite timely that we all know that we want to be healthy. No one wants to catch a cold, have a flu or COVID or spread it to colleagues, workers and families. And also we want to have healthy environments where we can live, work and play. So it's with great pleasure today that I welcome you to the launch of the report on the impact of indoor air quality on the transmission of airborne viral diseases in public buildings. This report has been prepared for the National Science and Technology Council by the University of Wollongong's Sustainable Buildings Research Centre. And they were supported by an expert panel made up of top researchers in multidisciplinary areas that feed into this field. So this report and associated advice from the National Science and Technology Council is now available on my website. So if you want to get there, probably the easiest way is to search Australia's Chief Scientist, go to the Resource Library tab, and then the Publications tab, and it should be there. Now, before I start, I have a few housekeeping things I want to go through. Our presenters will keep their cameras on. The cameras and microphones are disabled for all the other attendees. And also that we're going to record this as well. However, we also want to make sure we have as much discussion as possible. So we want to hear from you, the over 400 attendees, through the question tab, which you'll be able to find on the Teams link. So please post your questions in the Q&A tab, and if possible, indicate who the question is for. And if you see a question you like, we encourage you to use the thumbs up button rather than asking a similar question yourself. We will gather all those questions, so if we don't get to them during this event, we will ensure they are shared with presenters and we'll follow up where possible. Now, remember, this webinar is open to anyone who registered, and we have not restricted attendance in any way. So this is very much a public discussion. We're going to begin with Assistant Minister Kearney and Dr. Michelle Ananda-Rajah, both of whom have a close interest in this topic. Assistant Minister Kearney requested the National Science and Technology Council to do this work. And then the report author, Dr. Georgios Kokkianalis, is from the University of Wollongong, and Professor Brett Sutton from the CSIRO, who is also the former Victorian Chief Health Officer. And they'll present the findings of the report and the NSTC advice that arises from it. So please remember that my role and that of the NSTC is to provide evidence-based advice. It's not about opinion and it's not about advocacy. So Professor Sutton, who also assisted the NSTC in the preparation of this advice, was supporting Doug Hilton, who is the CEO of CSIRO and an NSTC council member. He supported him on this project because Doug was the sponsor for that project. We have set aside about 45 minutes for discussion. So we have 5 guests who have joined us for that discussion. We have Genevieve Quilty and Stephen Brohaus from the Department of Health. And as you're probably aware, Health is also doing detailed work in this area. We have Gary Rake from the Australian Building Codes Board with us as well. And we have Anna Maria Arabia, the CEO of the Australian Academy of Sciences, and Tina Parolin from the Australian Council of Learned Academies, or ACOLA. So this webinar marks the completion of the NST's work on this topic. So I'm pleased to have been able to create this opportunity for others to consider our findings and also come together for this discussion. So now, having done those preliminary introductions, I want to ask Assistant Minister Kearney and Dr. Ananda-Rajah to say welcome to you and ask you if you'd like to just give your background as to why you think this is important and why you asked us to do the work. So over to you, Minister.
Thank you very much, Kathy, Dr. Foley, for that beautiful introduction. And a big thank you to everybody for coming on the seminar today. I too acknowledge the traditional owners of the land on which, well, I am seated on the land of the Wurundjeri people of the Kulin Nations in my beautiful home electorate of Cooper, named after William Cooper, a great First Nations man and wonderful activist. I pay my respects to elders past and present, and of course I extend that respect to all First Nations people joining this very exciting event today. And I am incredibly excited by it. I want to thank you, Dr. Foley. When I came to you, you embraced this idea with gusto, and I really can't thank you for the support and work and effort that you have allowed to happen and that you personally have put into this report. I want to thank the project team and everybody who supported the development of this report, including Professor Sutton and Dr. Coco Hianakis. I hope I said that okay. Such a beautiful name. I'd also like to acknowledge Minister Husick's support of this project, because the National Science and Technology Council falls under his purview and in his ministry, and he also is extremely supportive of this work. And I hope that he's going to be a great ally to us in the next steps. To all my colleagues and friends in the various departments, thank you very much for being here. I'm so grateful to you all. And I know that it's quite daunting to think of the number of absolutely brilliant people out there who are listening to this webinar. Some of the best scientific minds in the country, I'm sure, but also a lot of interested people out there who have concerns about this, just like myself, my colleague Michelle Anandaraja, Dr. Anandaraja, who's just been a powerhouse behind this project and wouldn't have happened without her, and to everybody who cares about these things very deeply. I personally am one of those people. I guess my background is nursing, and this issue of clean indoor air was highlighted for me, like all of us, during the COVID pandemic. And it really brought home to me just how important indoor air quality is. We all have standards and laws and regulations about outdoor air quality, and of course that is incredibly important. And I think the Black Summer bushfires showed us just how quickly our air quality can change, shrouding, vast parts of our country in dense smoke and affecting a lot of people's health. But indoor air quality, of course, in my view, and I'm glad to see from everybody that's here today, is just as important. And I watched with horror, like everybody during the pandemic, how people were affected by that terrible disease. But I also watched my fellow nursing and health professional colleagues doff and don and wear protective clothing and risk their own health and well-being through going to work every single day. And it just brought home to me so clearly how important clean indoor air is for everybody, not just our health professionals, but from my perspective, I really saw it in that context. And a lot of people came to me and talked to me about it, people from the Burnet Institute, people from patient representative group bodies, people from other scientific organisations, many of whom are here today, and spoke to me about it and said, we really need to do something about it. And then the clincher for me was the amazing Michelle Anandaraja, the member for Higgins, who lived and breathed it during the pandemic, who really was so concerned about this. And Michelle just was, as I said before, an absolute driving force. And I think the pair of us conspired, if I can say that, Michelle, to do something about this. And it was recommended that we go to Dr. Foley's very fine organisation. For me, this is about the nation's health, but coming from the trade union movement, some of you may not know, but I headed up the ANMF, the Australian Nursing and Midwifery Federation, for many years. And it brought home to me that this is an occupational health and safety issue for every single worker going into a workplace. We should be able to provide them, and it is a duty of care in my mind, for workers to work in safe environments, whether it's aged care, childcare, schools, healthcare facilities, even office buildings, the importance of them working in safe, clean air is incredibly important. So I'm very much looking forward to the discussion today. I think you'll find the findings fascinating, helpful, important, just as I did. I just want to mention that adjacent to this wonderful work that has occurred, the interim Australian Centre of Disease Control and the Department of Health and Aged Care is working on a broader complementary discussion paper looking at the health impacts of indoor air quality generally. And of course, this wonderful work will feed into that, and it will create a very good body of evidence for us to work from. The department is planning to seek my endorsement of the paper following engagement with a range of government stakeholders. So really looking forward to that work. And Genevieve Quilty, I know you're on the line. Thank you for that, doing that work as well. I was very pleased to see, I'm sure you all know, that the Victorian government has recently made some announcements. They've dedicated $16.8 million for a trial of new indoor air quality technology in aged care, and another $10 million for the Pathway to Indoor Air Quality project. So both of these investments will be delivered by the Burnett Institute. And a very special hello out there and shout out to Professor Brendan Crabb and your team. You've been incredibly helpful, along with many others, on this journey to this day. So thank you for all the work that you do. So congratulations. I'm very excited by this report. I'm very excited for it being a very vital part to what is actually working out to be a jigsaw to how we can make sure that our indoor air is as safe as it possibly can be. So thanks, everyone. And I know you'll get a wonderful first-hand view from the good Dr. Anandaraja about how important this is.
Over to you, Dr. Anandaraja.
Thank you, Dr. Foley, and thank you, Jed, for that kind introduction. I want to thank and pay tribute to the many hundreds of Australians, if not thousands of Australians, who've been advocating for indoor air quality standards. And I'm coming to you from the land of the Wurundjeri here in Victoria, from the seat of Higgins in Malvern, which is quite sunny today for a change. The pandemic experience was quite different for me. When I was in the throes of that pandemic, I was pretty much wrapped in plastic, in PPE, working shoulder to shoulder with my colleagues in hospital and caring for patients. And I've got to say, it was a pretty bleak experience. We had patients who were short of breath, who were confused, who were disconnected from family and friends, and we obviously lost many people. But again, like Jed, the real impact for me was the effects on our health workforce. And we're talking about registrars who are junior doctors being so stiflingly hot and exhausted that they were near collapse, and me having to catch them, me unable to even talk to patients because I just couldn't do it. It was so unpleasant, the experience, and really trying to make that connection with a patient through a mask and PPE is very, very difficult, if not impossible. I saw nurses disrobing and cleaners disrobing in the scrubs rooms with their scrubs absolutely soaking wet. And we're talking about you could squeeze sweat out of it. There was just not a dry inch of clothing left on them. And then, of course, I recall a time standing outside the corridor, outside the nurse unit manager's office, and hearing weeping from behind the door. So that was the experience for me during this pandemic. And, but we got through it. And it certainly was the reason that, spurred me into entering politics. And when I came into politics, I found a partner in arms in Assistant Minister Ged Kearney, an absolute champion, someone who really listened during my maiden speech and then grabbed me afterwards and said, right, we need to do something about this. And thanks to Jed and her advocacy internally, because obviously I'm a newbie to politics, but thanks to Jed and Minister Husic, we managed to get this wheel turning. And the culmination is a fantastic report by Dr. Foley and her team, with advocacy from the Academy of Sciences, who were just incredible during the long COVID inquiry. And I want to also give thanks to the many hundreds of Australians, the individuals and the organisations who made contributions to that long COVID inquiry. One of the key recommendations, I think it was recommendation 8, is to work towards indoor air quality standards. And today's a major step in that regard. the only other two things I just want to talk about or touch upon is the pandemic challenged all of us. It tested all of us, but it should also be a moment to pause and to challenge our mental models. I am very much a disciple of evidence-based medicine. I am a product of that system, and it works perfectly fine for ensuring that our drugs and devices that we roll out to millions and millions of people are safe and effective. For complex problems like indoor air quality, which is essentially a complex problem in a chaotic environment, which is the real world, it may not be the best model. So we may need to take a more mechanistic approach to fixing a problem like this. And the analogy would be, if I was faced with having to make the public transport system more efficient, how would I do that? I'm probably not going to do a randomized control trial, but I'm going to take a more iterative approach to fixing that problem. So I would just ask that the technical experts not be shackled to p-values in trying to solve this problem. I'm not suggesting anything goes, but I am asking that we perhaps broaden our approach to fixing this problem and lean heavily on our engineers, our modelers, and so on and so forth, and behavioral scientists, absolutely, in order to drive this forward. And finally, I just want to say that now that we have this wonderful evidence base, which is obviously going to evolve in time because science never stands still for anyone, we need to think carefully about implementation. And I think this is really where the rubber hits the road now. We know what we need to do, but we have to implement. And unfortunately, too often, I think we put a lot of effort into building the evidence and the knowledge. We don't put enough resourcing into implementation, and that's really that's where it matters. And my analogy here I would give everyone is this, that if I was to give a sick patient an antibiotic at half strength, the chances are it wouldn't work. And then the mistake would be to turn around and say all antibiotics are useless, they don't work, and throw the whole thing out. So if we don't get this right, this is what would happen. Australians and organizations and businesses will lose confidence in the science. This is why implementation is important. Getting it right is important. Putting enough resourcing into it is important so that we actually do demonstrate the results to the end user, whoever that might be. And I think our next focus now is on next steps. What are they going to be? What are they going to look like? But that's going to be a broad discussion, and we want to hear from the Australian people. We want to hear from stakeholders all over the country, and hopefully arrive at a roadmap that we can take forward and implement as policy before the next pandemic hits us. Thank you very much.
Thank you so much, Dr. Anandaraja. It's really good to get that background and also hearing the extraordinary challenges, which I think too often those of us who weren't at the front line were just worrying about whether or not we had to work from home and get used to Zoom meeting after Zoom meeting. But instead, it's a real reminder that this was a really difficult time and that now's the time for us to be prepared, as you said, for the future so that we don't have that same lived experience. So now we're going to move on to hearing from Georgios and Brett and hear the findings from the report and the advice to government. Just remind you, don't forget to put your questions in the Q&A. And so Brett, I think we're going to go to you first.
Thank you, Dr. Foley. And I'll just pull up some notes for myself. And yeah, just by way of introduction, Dr. Foley, as Chief Scientist, asked CSIRO to be the sponsor for this piece of work. Obviously, it's the work of the University of Wollongong, and I think Georgios Kokoggiannakis and his team have done a fantastic job. But I'm really providing a summary and a kind of overview of the summation of the research evidence that was out there. And maybe the first thing to say with respect to the process of scientific review of existing research is that it's constrained by the research that's been done. And to Dr. Anandaraja's point, there are some really tricky questions out there with respect to indoor air quality, and constructing research around that in a controlled environment with cases and controls or with randomized clustered trials is a really tricky piece. And I think there are probably many gaps that are yet to be filled in terms of that research. But But Georgios and his team have done a fantastic job of stratifying the levels of evidence and using the highest quality evidence that was out there as part of the summation to come to these key findings. It's also important to note that the NSTC does not seek recommendations in the scientific review process. It asks for findings to be collated and summarised, and so it's also important to recognise that this research summary, rather than being the be all and end all, is probably the beginning of a process and is one part of all of the things that go into policy making for government or for policymakers more generally. There were 5 questions that were put to University of Wollongong to explore, and they probably go from easiest to most difficult. So I'll just go through those systematically. The first was really a view on what the evidence said about transmission. And the bottom line for that first question is really that transmission for airborne, for respiratory viruses, is that they are able to be transmitted from short distances all the way to long distances. Transmission occurs in 3 stages, from generation and emission to transport to susceptible individuals, and then inhalation and deposition into the lungs. But it does occur over short and long distances. There isn't this dichotomy that respiratory viruses stop at 1.5 or 2 metres. There was absolutely evidence from sampling, from epidemiological analysis, and from genome fingerprinting that both short and long-range transmission occurs. So as a conceptual basis for the subsequent questions in this summary, it's very useful to land on that as the first point, that if transmission didn't occur over long distances, then a lot of these interventions wouldn't have a role at all. So at least conceptually, the idea that long distance transmission occurs is a good conceptual foundation for looking at some of these strategies to improve indoor air quality. In terms of that second question, what are the strategies? In general, HEPA filters and ultraviolet lights, UVC lights, have shown efficacy in reducing infectious aerosols in controlled environments. That's especially true in healthcare settings from the research that was looked at. There have been variable results in non-healthcare settings, and a lot of the effectiveness of those strategies have shown variable results because the effectiveness is highly dependent on the proper sizing, positioning, and design considerations, what the intervention looks like by virtue of the indoor space that's being dealt with, and then the activities that are occurring within that space, the number of people, and all of those other elements that I spoke to, where those filters and UV lights are positioned. In terms of UVC, they have been shown to be effective in a range of scenarios. They do require optimal sizing, positioning, and design. There are potential dangers with direct exposure of people to UVC light, and some of the safety measures like louvers can reduce the effectiveness. So it's another consideration in terms of that balance of safety and effectiveness. Dilution and dispersion control, mechanical or natural ventilation to dilute indoor air contaminants is the essential mechanism here. But there are complex airflow characteristics within indoor spaces that influence the contaminant spread. And so again, there needs to be careful consideration of the ventilation grill positioning. General caveats: larger spaces might require commercial scale air cleaners. They can be noisy and potentially unsuitable for some noise sensitive environments. There is further research required to optimise air cleaning systems and to quantify their benefits, especially in varied indoor environments. And effective airborne disease transmission control requires a multifaceted approach and has to be tailored to those specific building types and those scenarios of use. The third question was on IAQ monitoring, so indoor air quality monitoring. It was certainly shown that it can help in reducing airborne disease transmission by identifying those high-risk areas and therefore informing the mitigating actions, such as augmenting natural ventilation, using HEPA filters in those high-risk environments, again, that come to our attention through the monitoring, or implementing behaviour changes in indoor spaces, such as mask wearing, such as how you control the numbers of people within those indoor spaces. There are multiple IAQ monitoring tools and technologies which can provide valuable data for managing indoor environments. They are all affected by constraints in feasibility, cost of use, significant variability in the monitored metrics according to the indoor location, the stratum within an indoor space, the time point at which that measurement occurs, and the activity indoors. And so one of the findings in the summary is that there's no definitive fixed number for any of those monitoring tools with regard to metrics, but there are ranges that can give a broad indication of higher risk environments and lower risk environments. The other point about monitoring for CO2 in particular is that if augmented ventilation is occurring, so if you've got HEPA filters within an indoor space, they are filtering the infectious particles, but they are not going to have an impact on the CO2 levels. And so you can have high CO2 levels with HEPA filters being in place, or indeed with UVC being in place, where the indoor space is safer from a infectious disease transmission point of view, but the CO2 levels might be high. So again, no one measure will necessarily be the be all and end all. The fourth question was around energy efficiency implications. As a general rule, building energy efficiency may be impacted by mitigations for indoor air quality, and that obviously has implications for energy consumption. We are moving to an era in the world, with climate change in particular, where the leakiness of homes needs to be addressed in order to create the kind of thermal efficiencies, and that can have implications for how you manage indoor air quality. Clearly, increased mechanical ventilation in particular can lead to higher energy use with HEPA filters running. Therefore, energy efficient solutions need further exploration. And obviously, changes to the grid and how much green energy goes into the grid has implications for the use of those energy hungry technologies as well. So there might be less concern into the future as renewable energy feeds into building efficiencies. And then the final question was really the trickiest, and no critique of the team at University of Wollongong with respect to this, but it couldn't definitively answer the question of what's the delta of a reduction in airborne transmission that some of these mitigations can provide, and what would the economic benefit be. That's probably 6 to 12 months work as a single piece in and of itself. That said, the research that was looked into certainly showed that there are significant economic losses, both in terms of seasonal respiratory viruses as well as pandemic viruses that lead to direct and indirect costs. So direct costs being death, morbidity, long COVID, the testing costs, the PPE costs, and then indirect in lost productivity. And they are very significant, but they're not well defined at a population level in Australia in this paper. That was a huge bit of work, and there are probably insufficient research papers that can inform that question. And finally, the impacts of respiratory virus transmission are likely to be reduced through improvements to indoor air quality, improving overall health, overall well-being, but the exact magnitude of this effect hasn't been modelled. In terms of the potential impact for interventions, you'll see in the report there's a mixed bag of studies, and again, it goes to the particular context in which those studies took place, the strengths and limitations of those studies. Only the strongest evidence was used in this summation, and some of the studies were done in circumstances where they were less likely to produce an efficacious effect. So it is a mixed bag, but most evidence for IAQ interventions showed modelled or measured changes in the proxy measures of virus transmission, so in the aerosols or in the viral particulates themselves, rather than in changes to morbidity and mortality. There's limited high-grade evidence for direct association between the interventions for indoor air quality and reductions in illness or mortality. They will probably come in months and years to come, but that they weren't in huge number in these studies. The best proxy for a reduction in morbidity or mortality is really a reduction in infection rates in population cohorts, but there weren't a great number of those studies either. There was a classroom study in Italy that showed a relative risk of infection of students by 74% compared with natural ventilation alone. That's a significant finding. There was a study in a 176 cubic metre space using breathing simulators that showed a simulated reduction of 65%. In healthcare settings, it probably showed the strongest evidence for improving infection rates in the order of 50%. In educational institutions, again, a kind of mixed bag, but in model classrooms, a reduction in virus concentration by 68% when someone is near a HEPA filter, but only 12% when further away. So it does depend on those contextual elements. And showed a similar reduction in hotel settings. So there are hundreds of studies that have been looked at. They'll all be available in the report, and Georgios is best placed to answer the specific questions around some of those specific studies. Thanks, Kathy.
Georgios, well, first of all, thanks, Brett. That was a really good overview. And Georgios, I know that you didn't realise what you were getting yourself into when you were taking on this massive piece of work. But do you want to just use this moment to go through and just highlight any of the things you'd like to raise to share with the audience today?
Thanks, Kathy, and thanks, Brett. I think you covered the content of the report really well. All the 5 questions there were important, and they followed a very logical order. There's a lot of detail in the report, so I suggest everyone who is interested in this topic to download the report, which is available now online, and go through it. And we're happy to answer questions around that. And I just want to mention here, Kathy, that as you mentioned earlier, the aim was to include only work where the conclusions were backed up by evidence through well-defined methodologies. So I think we have achieved that aim in the report. We developed a database of publications with the help of many people who are online right now. That included about a bit more than 1,300 publications, which we scanned for relevance and methodological quality. And we ended up with about 300 of those publications to include in the report. There were some good documents that were even published around the end of the timeline of the project, and we included those in the report. And I'm sure, as Brett mentioned, there's some good work happening right now and will be published in the future. We were totally unbiased while analyzing and synthesizing the literature, as the chief scientist kept reminding us to avoid including any opinions in the report, especially our own opinions in this, and just focus on just synthesizing the evidence. So I don't have much more to add other than that. I will pass it back to you, Kathy, and thank you. Thank you for your help in this.
But also, Georgios, thank you, because I think everyone should realise that one of the wonderful things about the Australian research community is that whenever we reach out, or I reach out on behalf of the government seeking information from experts, everyone comes running and puts in 150%, and because they're so keen to support the government on having the evidence they need to make the best possible decisions. So look, now we're going to move on to the question and answer session. So don't forget to put your answers or your questions in the Q&A tab. But I thought we might just quickly introduce our guests and hear a quick comment from them to kick this off. So our guests are Genevieve Quilty, who's the First Assistant Secretary of Health, Stephen Bauhaus, who is the First Assistant Secretary of Health, Gary Rake, who's the Chief Executive Australian Building Codes Board, Anna Maria Arabia, who's the Chief Executive of the Australian Academy of Science, and Tina Parolin, who's the Chief Executive of the Australian Council of Learned Academies. So, Anna Maria, I'm going to throw to you first, since I know this is something which was really important from the Fellows of the Academy of Science. Do you want to just kick off with your preliminary comments?
Of course, thank you so much, Kathy, and thank you for everyone who's assembled today and all of the work that's gone into this. I'm so pleased that it's been able to make it to the National Science and Technology Council's agenda. There are 1,000 people I would actually like to recognise, but I won't for the in the interest of time. I think this report really does give us a foundation to look at what's next in terms of action to achieve clean indoor air. And for me, it absolutely consolidates a couple of things. And that is that we don't routinely measure and monitor indoor air in Australia. So some of the limitations that the authors faced and the absence of data is because we are not measuring and monitoring indoor air according to standards because their clean indoor air standards haven't been set in Australia. I don't want to underestimate the complexity of doing some of the work that's needed, but it does bring home for me the need to have a bit of an action plan and that recognises just how cross-portfolio this issue is and how multidisciplinary this issue is. It's tremendous that there's been a focus on viral transmission, but some of the work that's been done by Fellows of the Academy of Science look at air quality through the perspective of bushfire smoke, of exhaust smoke. What does that do to a classroom environment? What does that do to a space where we occupy or where we spend 90% of our time? And in the absence of some of that monitoring and that data collection, it is very hard then to determine whether any changes or actions we make are having a positive effect or not. Again, I don't in any way wish to underestimate how critical it is that we are able to measure viral transmission and deal with that. I think we have all felt the impact of the pandemic and know how critical that is, and we need to prepare adequately for the next one. So, but all of the effects on our physical and mental health, on our productivity, on kids' ability to learn in classrooms, I think is something we need to focus on. All that to make the point, it's multidisciplinary and cross-portfolio. And I feel if we are looking at implementation and taking these results, the terrific work being done by the Department of Health, CSIRO, the Burnet Institute, the wonderful champions we have in our Parliament, thank you, Michelle and Jed, if we were to look at the next step and having this inform being actionable knowledge, as we like to call it, so knowledge and evidence that informs action, we really do need to look at how we can bring together the different portfolios who have a stake here, as well as the multidisciplinary expertise to coordinate what that action plan might look like. My last point, Kathy, it'd be worth noting that the Australian Academy of Science has been doing work in this area for some time, together with some of our partners, and it's all informed by our fellows and other researchers across Australia and the world. We ourselves are doing a broader policy focus synthesis of evidence based on indoor air quality, which will include case studies in the education sector. So that's a series of papers that will be finalised towards the end of this month, and that, of course, we will share publicly as we always do. Something that is multidisciplinary, I think, always calls for the involvement of ACOLA, the Council of Learned Academies, which brings together all of the learned academies across Australia who can all bring to bear their expertise. And I often use this example from the pandemic, and I hope it doesn't trigger anyone. I'm looking at you, Brett, here. But, you can technically devise a COVID-19 app, but unless you consult the social scientists, getting people to use it and looking at behavioural change and practice means you're only half implementing. So the more we bring to bear the multidisciplinary experts of our nation, the better, across a comprehensive range of issues that go to indoor air quality, with the wonderful champions of our Parliament and the various ministers whose portfolio this impacts. We are really keen to continue to remain involved and support the work of the National Science and Technology Council lead ministers and others on this call. So thank you, Kathy.
Thanks, Anna Maria. And Tina, what about the Council of Learned Academies? Because you include a broad range of academies, not just the sciences, but also social sciences and arts and health and medical. So just I'm curious to know if you want to make any comments too from the research sector or any questions you might have.
Thanks, Kathy. Yeah, look, I might just add that, Anna Marie, you might have inadvertently triggered me with that response because I worked closely with Genevieve Bell at the time on the report to NSTC on the COVID Safe app. But look, yes, the 5 Learned Academies all come together under the forum of ACOLA, 5 Learned Academies that represent an incredible breadth of disciplinary expertise in Australia. So we have the Academy of Science, clearly, that Anna Maria heads up, but we also have Technology and Engineering, the Academy of Humanities, Social Sciences, and Health and Medical Sciences. And I guess what this report has really demonstrated is that the complexity of these issues, and it has highlighted that need for multidisciplinary perspectives, which will be just so critical to take this to the next step. Assistant Minister mentioned the jigsaw, and it's very much a jigsaw, and I think that's where ACOLA can really help play a role in identifying what are the pieces of that jigsaw that we need together from the social and the cultural side of the equation, as well as the science, the tech, health and medical. So I think the multidisciplinary and multi-domain expertise is going to be really critical to next steps to ensure that whatever interventions and implementation strategies don't disproportionately fall as a burden on particular communities, right through to the sorts of interventions in education spaces that Anna Maria mentioned and the various impacts, but also, I guess, where some of the interventions may have an effect of improving that improvement of air quality, may have those positive consequences and repercussions on some other aspects of human health and behaviour, that to make sure that we're looking at it holistically. And so yes, thank you to the report authors for raising a lot of those issues in the report.
Thanks, Tina. It's great to hear, and reminding ourselves that it is multidisciplinary, as both you and Anna Maria have mentioned. So I might move to our colleagues from the Department of Health. Genevieve and Stephen, what's your view as to what this means from the Department of Health, noting that it is a cross portfolio issue, but how are you seeing the sorts of things that are going to be next in mind from the Department of Health?
Thanks, Dr. Foley, and thank you everyone for this opportunity. Stephen and I are coming from Ngunnawal and Ngambri country, and I'd like to pay my respects also to the First Nations people of Australia. So it's an incredible opportunity to hear from all of you, and the questions that we're just about to hear as well. As Assistant Minister Carney talked about, we see obviously we're leading in the health aspects, but it absolutely is cross-disciplinary across the Australian Public Service, and we've got Gary here today from the Australian Building Codes Board. We also work across the portfolios with our colleagues in the Climate Change, Energy, Environment and Water portfolio who oversee the National Clean Air Agreement, and of course we work alongside the Safe Work Australia colleagues who also address indoor air quality in occupational settings. And our colleagues in education, of course, have a deep and abiding interest in the work and the way that we can improve educational outcomes. So I guess our focus, certainly from interim CDC point of view, is on the better health and wellbeing. And it was incredible to hear the points of view from AM Carney, as well as from Dr. Amanda Raja, in terms of the impact that this could have had during the pandemic had we accelerated this work. So as Assistant Minister Carney said, we have a subcommittee of the AHPC, NHealth, who have been requested by the Australian Health Protection Committee to prioritise indoor air quality work from a health perspective. And so part of that, of course, is this important piece of evidence-based advice that we're talking about today. We'll be undertaking a discussion paper that Minister Carney spoke about. Our discussion paper will be broader and include the advice in this report. We'll also be looking at the health impacts on including cardiovascular disease, cancer, asthma, diabetes and other issues. But we'll also be looking at the positive health impacts of, which we've also heard about today, for better indoor air quality, such as improved cognition, including for children and all of us who work in buildings all over Australia, with those flow-on impacts for educational outcomes and economic productivity. And we're really encouraged, Anna Maria, you did flag earlier that there'll be some additional work coming from the Academy, so we're keen to receive that information and evidence base to supplement the work already underway on behalf of the Australian population through our nHealth committee. Thank you.
Thanks, Genevieve. Stephen, did you want to add anything else?
No, I think it's been well covered by the Minister and Genevieve.
Look, Gary, we're talking, of course, about built environment, which is your bread and butter. Just curious to know if you've got any comments at this stage about, you know, what this really means, because it has an extraordinary impact potentially on how we build and implement this, especially since we heard that it's very situationally based, and it's not like you can have a single design and a single process, that it's a methodology. So I'm just curious to know what's in your mind at this stage, having heard all this information.
Yeah, sure. We write the National Construction Code, which is the rule set for all new buildings across Australia. And a couple of the unique perspectives that we bring, it's a performance-based code. So we're able to set performance objectives rather than just writing single prescriptive rules. So it gives us more flexibility to deal with risk and scenarios. We also get to deal with competing priorities, and Brett talked earlier about the potential competing priorities between indoor air quality and energy efficiency, for example. It's the job of my team and I to synthesise those and try and reconcile them. So we regularly receive requests to look at indoor air quality and potential changes to the code, and our starting point is evidence around the problem, evidence around the solutions, and in areas like buildings being very complex, a small team can never get their head around all of the evidence. So we really appreciate this as a body of work that has helped synthesise a lot of evidence and bring it together, and it's a really useful base for us. So we look forward to cooperating with the other parts of government that are looking at this, and we hold one of those levers in readiness. Thanks.
Fantastic. Thanks, Gary. Look, we'll go to some of the questions now. I'm going to start with one from Paul, which is actually, I'll just read it out. It's a very thoughtful question. It says, it's indoor air quality, a layered approach with measurement, displayed measurement, air filtration, ventilation, filtered far UVC lighting, UVGI, respirator masks, infectious diseases, sniffers. Are these, I guess you're saying, you know, sort of how, is it something where it's not just a one size fits all, do this and it will lead to better outcomes, but it's actually a mixture of different interventions that are needed, that are layered up to create that air quality improvement. So there's not a particular person to go to this, but I'm wondering, Brett, if you might want to just first of all jump in, because you're taking it from a holistic view and from practice.
Yeah, thanks, Dr. Foley. And I said this to Minister Husic at NSTC, which is taking an occupational health and safety view, you would look at that hierarchy of controls, and absolutely the layered interventions would be in place. And some are more foundational than others, and the building code would be the most foundational in the sense that it gets designed into as a mitigation. And the bits that you try and minimise are the so-called administrative controls. They're the controls of last resort. That happens to include PPE because it's done at an individual and personal level. Now, you absolutely need PPE in a pandemic, but what you want to do is to make sure that all of those other layers of control means that when that protection of last resort is in place, that it's not doing all of the work. It's doing the little bit of work that can protect that worker. So yes, I would agree that it's a combination of interventions, and I think Georgios pointed out in the report that UVGI works better when air is circulating, and so having air movement in combination with UVGI is one of those things that creates synergies in terms of those mitigations, because UVGI tends to work at the top layer of air within an indoor space up at the ceiling, because UV needs to be kept away from people's eyes. but it needs the air to circulate through that space in order to be most effective. So in short, the answer is yes.
Yes. So look, I also just want to, I think there's an important message from Lynn Jackson, and thanks for reminding us, Lynn, and just saying that we must remember we've been talking as though COVID is a thing of the past. It's actually still very much with us. And that we need to be really mindful that this isn't just something which is a nice reminder of bygone days where things were pretty crappy, to technical term, to being something which we need to prepare for the future. This is actually part of our lived experience now. So thanks for those comments, Lynn. But one of the things I do want to move to is there's a couple of questions here relating to sensing, and Georgios, I might need to go to you on this one. Is it's looking at the moment there. If I remember reading correctly, there's actually no real indoor monitoring process that is able to give us real-time feedback. Most of them are proxies. And so one of the questions here is, and I've just lost, where is it? Saying that that how do you know with a monitorer? Yes, yeah, I'm privileged in that, and this is from Lisa Kay, that I can afford to carry around a CO2 monitor, and I know how to use it as a tool along with their N95 mask, so that late approach. But many people can't afford them, and many people have no idea about air quality with regards to disease being spread. Are any states or is the federal government planning to a health promotion campaign about this? So I guess there's two aspects, and maybe it's, first of all, hearing a little bit more detail about these monitors, because it's not quite as straightforward as a proxy immediately saying, and I know, Brett, you said measuring CO2, you can still have disease present or not present, even if it's low. But Georgios, do you want to just summarize a little bit about where you landed on that? Because I think that's a really important point.
Yeah, and a similar study was done in Europe on this, and they concluded they came to the same conclusion. Currently, there are no real-time bioaerosol sensors that can detect virus in real time, and there are some programs in US that are actually funding development of such sensors at the moment. So the best we have, I guess, is a CO2 proxy. That will not tell you whether there is transmission or not. That will not tell you whether you are in danger. It may tell you that there is higher risk when the levels of CO2 are really high, that there is a higher risk that people are actually around you may be transmitting a virus. And there are challenges with some of these sensors. Yes, some of them are very expensive. I had one at my home, a bit more than $1,000, and it's not. It needs calibration every now and then. And it's not, something everyone can afford. So,
yes.
Yeah.
So in fact, from researchers out there, I think one of the things, if you're trying to come up with a research project, actually coming up with a quality sensor that is cheap and actually able to give you true viral loading measurement in real time, that would be remarkable. But Dr. Ananda Raja, you also have spent a bit of time looking at the use of these small portable HEPA filters as well, and you said that that's been remarkably useful in your office, which I saw in real action. Did you want to comment about that?
Yeah, so when I came to office, I made inquiries within the Department of Finance as to whether the Parliament had mechanical ventilation installed, even portable filters, and the short answer was no. So I took it upon myself to purchase basically portable HEPA filters, which are made in Australia. Actually, it's a fantastic Australian company. And I bought 6 of them, and I have 3 in my office here in Malvern, and I have 3 in Canberra. And I mean, look, it's an N=1 experience, but it's now been going over two years. And people in my office, of course, they get sick. They bring illness into the office usually, but no one gets, there is no transmission of disease, of any virus in this office. So it's a very safe office, actually. And I've had like every other MP, and Jed would know this as well, we often have meetings in our community meetings in our offices. There might be, up for anywhere from a dozen to 30 people. And then inevitably I will get an email from someone saying, by the way, I've tested positive for COVID. And, we have these machines blasting 24/7 and when we're in the office, that is, and transmission does not occur. No one gets sick here. So I'm a believer, and I have lived experience with using these devices. Now, I have, on the topic of sensors and filters, I did recently visit a school in my area which won a grant and installed CO2 sensors in their classrooms. But, it's challenging in these environments because they have HEPA filters going, and the Victorian government rolled these out a few years ago. They've got these going and they've got the sensors reading. The sensors might be reading 1500, which is very high, but you don't know what that means when the HEPA filter is running at the same time, because the air is being filtered, but you've got this other reading suggesting that CO2 levels are very, very high. So I think, of course, there is more work to be done in this environment.
No, I think that's a really good point where, we sometimes have the evidence, sometimes we have gaps, and sometimes we've got areas where we don't really know and need more work done. But there's a question here that, does the report consider the co-benefits and unintended consequences of interventions relating to other airborne hazards in indoor environments? So that's a question from Angela Cartwright. So I'm just wondering, Brett, that might be one for you to answer.
Yeah, thanks, Kathy. I guess the obvious thing to say is the specific request here was around respiratory viruses, and so the research summation has gone to that as the most significant issue on the back of the COVID-19 pandemic. That said, indoor air quality has all of these other dimensions, including CO2 in and of itself, having an impact potentially on productivity and on mental acuity, as well as dealing with allergens, as well as dealing with particulate matter. So the so-called PM2.5, PM10, tiny particles that can be inhaled and are small enough to enter the bloodstream and are increasingly being linked to acute and long-term health outcomes. And so that's absolutely a co-benefit if you're going to use a filtration system that deals with respiratory viruses, that it's also going to deal with allergens and going to deal with particulate matter, and natural ventilation might also deal with that issue of high CO2 levels that can have a separate and distinct impact.
That's a good point. Actually, a related one is from an anonymous person saying that they had surgery last week, but very few staff actually wore a mask. And when they were in the room alone, their CO2 levels, they must have had some way of measuring that, was fine. But then when people were in the room, that increased substantially. And they're just wondering whether is that okay? Should patients expect better? What do we have a sense of, practice particularly in nursing homes or in places where people are vulnerable, what that we have enough evidence or information as to what's best practice to make sure we aren't spreading diseases in areas like hospitals, nursing homes, things like that? I'm not sure, Brett, or Dr. Nandaraja, if they're sort of being medicos working in the system. Any advice there?
Michelle?
Yeah, I mean, look, I think it's a bit ad hoc, really, the short answer. Victoria is clearly leading the way in this space, and has done when Brett was Chief Health Officer, really very, very forward facing. And now there's more evidence which is in train. There are studies that have been funded, and I think actually Victoria is putting the Commonwealth on notice, to be honest. So we've got a little bit of catching up to do. It'll be exciting to see the results from some of these studies. And I think that'll inform next steps. But again, I think we know what we need to do. I think we have some evidence. We have evidence now to guide initial steps. So I don't necessarily think we need to wait for a lot more data. I think this is the mistake that the trap we could fall into. We do have a body of work. It's been presented today. We need to take that now and work in this interdisciplinary kind of grouping and come up with some solutions for aged care, schools, childcare, businesses, places we recreate, so that we can keep Australians safe, healthy, and productive. That's the bottom line. And then as the data and evidence builds, we keep evolving with that.
So there's a question here from Dominic Meyer from JCRC, and I'll sort of reword a bit, but is there evidence for the priorities of implementation? So is there almost like a hierarchy where we'd have the best impact for individuals, noting that, you know, sort of this is a big deal if we're having to make major changes to deal with indoor air quality? Do we start with schools and classrooms first, or transport, hospitals, nursing homes, aged care, hospitals? I'm just curious to know whether you've got a sense, or is there some more work that's needed to understand what the hierarchy might be? So Giorgio, it might be a good place to start, and then Anna Maria, I'll go to you.
Well, that's a difficult one for me, but let me try. Obviously, healthcare buildings are very crucial because you have vulnerable people, and at the same time, you probably know the position of the person who is infectious and the person who is susceptible to be infected. So you could apply controls there to mitigate and prevent the problem. Then buildings like schools are also very important, much more challenging for many reasons. Some of the mechanical systems may create adverse issues. You know, you have to train the teacher to turn on, for example, a HEPA filter, make sure that doesn't impact in terms of noise the classroom.
That's true.
The delivery of the lessons. So it's a bit more, and it's a more crowded space really than your other, you know, a shopping mall may be less crowded, for example, and you have bigger volumes. There.
Anne-Marie, you had your hand up. Did you want to make a comment?
Thank you, Kathy. I really wanted to hone in on the comment of not being caught in a trap of more needs to be done. More will always need to be done, and we will always have advances in knowledge and solutions. But that shouldn't be a barrier to what could be done now because of the ample evidence that is available. There's some seminal work that's been recently published actually in Science by our fellow Professor Lydia Morawska that very clearly says that there are 4 key metrics that we can measure today with the technology available to assist us in setting indoor air quality standards. And they go to PM 2.5, which Brett mentioned earlier, and looks at particulates, so smoke and car exhaust and things like that. CO2, obviously, it's not a good proxy for viral transmission, but carbon monoxide is the other. And if we're measuring ventilation rates, the rate at which the air is being replenished, that's where the transmission can be slowed down. In terms then of its implementation in various places, there is also emerging evidence. So there are some terrific school studies that are being done internationally. There's a really good one in the UK, Corsami, the Boston Schools project in the US. Some of the knowledge that's coming out of that, just looking at the carbon dioxide levels in a primary versus a secondary school, there are differences there, and you can measure viral transmission within those classrooms. It is really instructive. So we have a lot that we can do now. Ideally, it would be in every indoor space, but you know, the healthcare setting, as Giorgio said earlier, is important, but we could be running some pilots on very, very well understood metrics that can be implemented without needing to implement every metric that's possibly available to us, and that would see us, I think, really reap the low-hanging fruit that's available.
So look, there's a couple of questions here relating to other things like mold pollutants and also secondhand smoking, which I can say the report didn't really cover them, but there's things to be learned, such as you know, bushfires and things like that, which we know that's like co-benefits, which we answered that question previously. So Assistant Minister Carney, I'm just wondering if there's a question here, is there a way to fast track clean air throughout Australia with legislation, or what is, is there a legal way to really push this through? Or do you have any at this stage thoughts about what might be a pathway forward to progress this?
Well, when I said thanks, Kathy, and thanks for the question, there probably is ultimately at the end of all this some legislative pathways that we could investigate. But in the meantime, I am very keen to get the results of the report from the department. I'm very keen, as I said, to pull together all the bits of the puzzle together. I hear what you're saying, Anna Maria, and I think that some good work is happening right now in Victoria, which we are watching very closely and are very keen to see how that goes. I think it was, I'm not sure who said, but this really is a cross-portfolio issue, and I'm going to need to do a lot of work to bring a lot of my colleagues together from, I've got Minister Husic, he's kind of on board, and that's great, but, really looking right across all of government, this is going to be a big, I think, if we're going to do something federally, I'm going to need the support of all of government approach. So, and having said all of government approach, I honestly mean federal, state and local government as well, who are incredibly important in this. We've got Gary there, whose organisation is going to play a big role. We need the Department of Education to look at this. We're going to need, all of those different areas to come together. So I think we're a little bit far away from legislation at this point, but Anna Maria is right. There's a lot we can do in the meantime. And I'm seriously waiting. As soon as I get that report or we get that discussion paper out, I think we can really see a way forward. I'm very interested in the CSIRO's work in this space. I know that Brett's keen to be doing some more stuff on this at the CSIRO. So the path forward for me is just initially wait for that report, and then we'll see where we go from there.
Okay, look, we've got a few questions here. I'll just, there's one here which maybe we can try and just have some shorter answers. So were any findings contrary to international experience? Brett or Georgios, any?
I don't think so, Kathy. A lot of the research was done internationally, so it forms the body of international experience. As I said, there was a mixed bag. Some of those findings were maybe against one's intuition, but I think also involved, for example, small numbers. There was a study in ICU which didn't show findings in terms of the benefits of mechanical ventilation, but I think ICU patients are an entirely different cohort when you compare it to the general ward population in hospitals, because they might actually be at the end or post their infectious period, and the other controls that are in place for managing transmission are very different in the ICU setting. So I wasn't particularly surprised by anything, but I think other lay readers or science readers might look at some of the findings and say, oh, look, that goes a little bit against what I might have expected in this space.
No, I think I'd agree with you there. Another quick question is there a highest recommended level for indoor CO2?
I don't think so. We made the point about recommendations not being part of this study, but a review of international regulatory and legislative schema I think might be useful, and it's probably the case that 800 or 1,000 ppm comes up more commonly than not in terms of a threshold where you tend to tip from lower risk to higher risk of viral transmission. But there might be different thresholds for particulate matter, and there might be different thresholds with different phases of seasonal risk or pandemic risk. So I think it's very context dependent, and it does depend on what the built environment looks like at the same time, and what activities take place, and the number of people within a setting. I think there could be a trap in saying one size fits all for a ppm for CO2.
Yeah, and look, we're getting to the end of the time that's available, but I have to say, Paul has suggested that maybe we should have pathogen sniffers identifying people with airborne infectious diseases such as dogs, or mechanicalistically doing that. So I think that's something. I don't know if you is a quick yes, interesting, or it's I think we do know dogs are very good at sniffing out things.
Biomimicry.
Interesting, probably not going to roll out in every hospitality venue, I suspect.
Well, that's and then there's a final quick question is, should there be standards like there is for drinking water standards? And I guess that's something from the Department of Health, because health sets the drinking water standards. So I'm just wondering, Stephen, anything from your perspective about where health is looking to go with this?
We do currently set the standards for buildings, but that would be through the building codes and other things. But those are things which would obviously flow through from the discussion paper and the kind of the evidence. And so looking at what are the different ways of taking things forward, and then which one give you the most results for different resources. And as Brett mentioned, that kind of layering approach as well. So having multiple interventions, and then also looking at different settings. So you might prioritize things in particular settings such as aged care or education in the first instance, where there's kind of the initial greatest need. So there's obviously a lot to be worked through there, but there's obviously quite a bit of a call for standards. Where you might set them and how you might measure them are also difficult questions, as Brett has kind of highlighted, talking about the CO2 monitors as well. So a lot to work through, I guess, on our end.
All right. I can't believe it, the time has passed. So Assistant Minister Carney, do you want to just final 30 seconds of what you've taken away from today?
Well, thank you very much, Kathy. What I've taken away today is that there's a lot of interest in this, that this is an important topic to a lot of people out there, and the work that your wonderful team have done has really set us in motion, and I'm very excited about where we're going to go from here. So thank you very much, everybody, for coming on board today. It's been a great discussion. Michelle, would you like to add something to that?
Yeah, absolutely. I think within every problem, there's always opportunities. And I think that they say that a crisis is a terrible thing to waste. And I think today is an example of learning from this crisis, coming together, and we know what we need to do. We now need a roadmap for implementation. We need to bring the multidisciplinary experts together to help guide this. And Jed and I need to go and do a bit of work internally to get this on the national agenda, which it absolutely deserves to be. And, at a time when productivity is on the lips of everyone, particularly our political class, this is low-hanging fruit. This is absolutely low-hanging fruit. If we can keep Australians healthy, then they will be productive. So I will end on that.
Thanks, great. Look, thanks so much. We're in the last minute. So I just want to say thank you to our speakers and our panelists, and thank you to the audience. It's been a great conversation. There's so many really interesting questions here. I feel awful that we haven't been able to spend enough time to give them the airtime that they deserve, but we will go through and collect them and see if we can work out a way to answer them and make those answers available. I also just want to have a quick advertisement reminding everyone that this is all about science and research. And next week is National Science Week. So hopefully you'll engage in that in some way. If you want to hear more about great science, Australia has an amazing array of publicly funded agencies like CSIRO, Bureau of Meteorology, and so on. There's 30 of those organisations, including regulatory organisations like the TGA, and we're having a STEM Expo in Parliament House next week with live streaming. So it's on the 15th of August. So go to my website for more details, and also for being able to find this report. So I want to also thank my team and CSIRO for supporting this event. And we'll close off now and say thank you, and thank you everyone for joining in and showing that this is such an important thing. We're looking forward to seeing how evidence can help the government be able to make the best decisions and have a good pathway forward for the future and benefit and well-being of everyone. Thanks very much. Bye now.